My name is Darren Seeger. I'm a GP at Moulton Surgery, and I have the dubious honour of being the chair of NHS Nene Clinical Commissioning Group. I'll just start off with our vision, which is really quite simple and quite easy to say, but it's really to help people lead the best possible life from beginning to end. As you know, public funding is incredibly under pressure, with 20% efficiency savings, up to 2014-15, and actually, depending on the economic outlook of the country, that is going to increase. That's coupled together with the population growth in Northamptonshire. And as you know, Northamptonshire is a place of huge population growth, and it's roughly the equivalent of having a town the size of Kettering increase in our county in the next 10 years. 1 in 7 people in the county are older than 65, and that's just going to increase. So we know that just more and more people are just going to get older, and they're the ones that actually need more health care. And if we stay the same as we are now, hospital workloads will rise by 50% over the next 30 years.
We know under urgent care that A&E in the county is under pressure. So let's have a look at the way we can do things more effectively through pathways, so that people can have care delivered where's right. At the moment, we're running a pathway for thrombosis in Daventry, where with a simple blood test from the prick in your finger, you can actually have your risk of a thrombosis worked out. And about 60% of people who previously would have had to go over to Northampton, we know are very low risk, and they can stay in Daventry. And probably the centrepiece of this, and the thing that we're really proud of and really want to work is something called our Frail Elderly programme, which is looking at how do we help prevent older people going into hospital when it's not necessary. A lot of older people end up in hospital because of an illness, because their carer is unwell, and actually those are things that can be dealt with at home. So it's really supporting that person and the carer at the same time. We go on to long-term conditions. We have been running a pilot in this county which has been really successful around people with complex mental health needs and personal health budgets, and it's been really successful. So what we now need to do is say, people with complex medical problems, can we help them with personal health budgets? Because we know that if people are able to take control of their own illnesses, help to do that, and often that's difficult, but we can help that again. We can allow them to live a much more fulfilling life. Primary and community care, well, I'm a GP. You know, we've got community beds written up here, but we are spending our whole time thinking about how can we make general practice more accessible. Absolutely, we want to be able to see the right person at the right time. Now, whether that's you're a working mum and you want to see somebody with your ill child at 8 o'clock at night, or you've got a long-term condition and you want to be able to see your GPs.
My personal view is, and my group's view is, GP practices have to improve what they do. If we can get the GP practice to make a decision, diagnose quick, then we've saved time, we've saved money. My healthcare problem is to teach people how to live well, to be happy, to smile, use their magic eyes, and think everything's wonderful, and then they won't be ill so much.